Welcome back. It's Dr. D again with Salisbury Eye Care and Eyewear, and today we're talking a little bit about what to expect when you're expecting. Today's video is about your eyes and what you might notice throughout those 9 or 10 months. All right, so today we're gonna talk a little bit about dry eye and why that might occur during pregnancy and what you can do about it. Women tend to be at a little bit higher risk of dry eye than men in general. This especially occurs around hormonal times. So the typical time to see that is around menopause actually. So I see a lot of my dry eye patients that are either perimenopausal or postmenopausal. However, there are other hormonal times in our lives, and if you're pregnant, you know that that could be one of those times. So because there are such large hormone shifts during pregnancy, it's one of those times when you can have drier eyes than normal. So you might be someone that suffers from dryness anyway, and it just gets worse during pregnancy, or you might have never had issues with how your eyes feel, and all of a sudden they're feeling dry. So let's start with what the symptoms of dryness feel like. Dryness actually has a lot of different symptoms, and it seems to be different for every patient, but it can range from having watery eyes, which sounds like a misnomer, but we'll link below. I've got a video explaining why dry eyes are often watery. So they can water, they can feel dry, itchy, or scratchy. It might feel like something's in your eye. You might feel like your eyes are burning, or just like they're more tired than normal. There's kind of a range of symptoms. You can also feel like you're just more light sensitive than normal, or maybe your vision kind of comes and goes. It gets blurry, and then if you blink a little bit, it's all better again. All of those things are symptoms of dryness, and there's probably even different ways to describe it. But if you feel like any of those fit your eyes, they could be dry. So hormones typically are what's causing it. You normally have these symptoms where your eyes just don't feel great, and you might be wondering, is this gonna stay forever? Typically, once your hormones regulate back out, you're gonna see a decrease in the symptoms. And so that typically will occur either after birth or potentially even after breastfeeding, because there are different hormones at play throughout, as you breastfeed. What can be done about dryness? Well, dryness of the eyes is basically an imbalance of the tears at the ocular surface. So first you have to kind of think about where the tears are coming from. So there is a sticky layer that's kind of the base layer of the tears, and then there's a watery layer, and then an oily layer. You need all 3 of those layers for your tears to coat the eyes and for your eyes to feel comfortable, but also for you to see really well. So one thing I encourage, of course, and if you're pregnant, you're supposed to be doing this anyway, is drinking plenty of water. Your water intake, the necessary water intake goes up during pregnancy. You have more fluid within your body. You're supporting another little one, so you have to get a lot of water, and that is true for your eyes as well. Another thing that helps with dryness in pregnancy is making sure you have great DHA intake. So omega-3s are something I prescribe for a lot of my dry eye patients. But if you're pregnant, you should be taking a great omega-3 anyway. I talk about this a little bit in one of my fetal development videos, but I always recommend the prenatal DHA by Nordic Naturals. That is a great one to support not only what's happening with your baby, but also to support your bodily processes and promote having good tears as well. Some other things that you can do kind of throughout your day, and it's just gonna depend kind of what your day consists of. But one thing you can do are artificial tears. Now, I have a couple of favorites with artificial tears. I am a bit of a purist when it comes to artificial tears. I don't like artificial tears with any preservative. I like to avoid putting any extra chemicals on your eyes. Having chemicals on your eyes can be inflammatory. It can not help the situation. If your ocular surface is already inflamed, you want to just avoid putting any unnecessary chemicals there. So I have two that I really like. There are certainly more non-preserved options, but I'm a big fan of Retain. Retain MGD is from a company called AcuSoft. It's available over the counter quite a bit, depends on the retailer, but it is out there. This stuff is got an oily component and a watery component and is very, very soothing. It's safe, if you do not wear contacts, it is safe. So you don't want to put this over a contact lens because it will blur it a little bit. It's okay to use artificial tears about 3 to 4 times a day. If you're having to use it more than that, then you need to talk to your eye doctor about other options. Now, Oasis Tears is my other favorite, again, non-preserved. What's so great about this one is it's not only non-preserved, but it's got hyaluronic acid in it. So HA, hyaluronic acid, is able to hold a great deal more than its weight in water. It is a water-loving molecule, and it's actually a lubricant that's found throughout your body. It's found in your tears naturally, it's found within your eye naturally, as well as in your joints to lubricate your joints. So HA, or hyaluronic acid, is actually found in a lot of skincare products as well. It's kind of having a moment right now, but it is available in artificial tears as well that are very, very soothing. And Oasis Tears you can use over top of your contacts. Oasis Tears are available usually at doctor's offices, but they may be available online as well, I'm not sure. All right, so artificial tears are one thing you can use. You also want to make sure you're cleansing the eye area really well. This is most important if you tend to have a buildup of debris around your eyelashes. So I really like these AcuSoft lid scrubs. You can use these at night to kind of cleanse away any extra makeup or debris from around your eyes, and that'll help prevent your eyes from getting so dry. And then finally, something that is good for just about everyone who's ever tried it is a warm compress. So I'm a big fan of these Brooder masks. They're certainly not the only ones on the market, but these Brooder masks have medi beads in them. Basically, you heat this in the microwave for about 10 to 15 seconds at a time. You test it against the back of your hand. You don't want it to be too hot. But then this actually fits over your eyes, and that warm compress is going to loosen up the oil glands and promote having the oily layer of the tears in good shape. So these are just some kind of, I call them adjunctive, or just things you can do at home that are relatively simple. Warm compresses, you want to do that for 10 to 15 minutes. Less than that and it's just not effective. You do not want to do a warm washcloth. It's worthless. Warm washcloths are worthless. Warm washcloths are worthless. You know what I mean. We're gonna leave that on there because it's hilarious. You get what I mean. All right, so use a good warm compress, 10 to 15 minutes. Cleanse your eyelids and make sure to get all of your makeup off. Take lots of breaks when you're on the computer. Every 20 minutes, look 20 feet away for 20 seconds. We can link down below our 2020 video. Use artificial tears that have no preservative in them. If you are experiencing dryness from pregnancy, definitely go see your eye care provider. They can help you in many, many more ways. There are a ton of medicines that I won't get into that we can prescribe. They all have benefits and risks, and so I want to leave that to you and your eye care provider. But these adjunctive things that we just went over, they're just a great place to start, and they might give you some relief through these next few months until you meet that little one. All right, thanks again for tuning in. We appreciate it, and we have new videos for you coming every single Wednesday at 4 o'clock. We'll see you next time.